back to my YouTube channel. It's your girl Wachiko Victoria. If you are visiting my YouTube channel for the first time, please hit the subscription button and click on the notification bell, and that way you'll be notified each time I upload a new video and you become part of this wonderful family. In today's presentation, I'll be talking about preconceptional care as a pathway to a successful pregnancy journey. Do you know that some miscarriages occur as a result of lack of pregnancy care? Do you know that some congenital abnormalities, example, Down syndrome, which you literally call Mongolism, is preventable and not treatable? Do you know that delay in achieving pregnancy can be a result of you and your partner not actually taking good care of your body? Do you know that fetus, which you literally call babies, has the right to develop, mature, and be born alive without any form of abnormalities? By definition, preconceptional care are those measures adopted when taking care of a woman and her partner in order to enhance their chances of giving birth to a healthy baby. Now, if you fall in between this category of people I'm going to be mentioning, you need to pay attention to the information I will be releasing in this video, because they are going to be very much helpful in helping you give birth to that healthy baby which you are dreaming of. The first category of people I will be mentioning are the people that are trying to achieve pregnancy for the first time. The second category of people are people that have been pregnant before, but they had one or two complications. Complications such as miscarriages, death of the baby in the uterus, or death of the baby few hours or days after delivery. The third category of people are people that are having difficulty in achieving pregnancy. The fourth category of people I'll be mentioning are people that has one or two medical conditions that can endanger their life or the life of the baby. The fifth people are people that doesn't belong to this category of people, but they know one or two persons that needs this information. Now let's look at the 9 areas of focus in order to achieve a successful pregnancy journey. Number 1, learning about your family history. Do you know that some family has familial diseases that can endanger the life of the mother and the baby during pregnancy? Some conditions such as diabetes mellitus, hypertension, epilepsy. Now these conditions can actually endanger the life of the mother during pregnancy and not actually manifesting before pregnancy. For an instance now, diabetes mellitus, a mother might not actually manifest the signs and symptoms of diabetes mellitus, but during pregnancy, you will see her developing what we call gestational diabetes. That is, the diabetes manifesting when she is pregnant as a result of changes that occur during pregnancy. This diabetes mellitus can cause serious conditions to the mother and to the baby. To the baby, it can cause congenital. All you need to do is you meet your health caregiver before achieving pregnancy or before getting pregnant in order to pay attention to this condition. The second one is maintaining an ideal body weight. There's what we call body mass index. Now, if your body mass index is less than 18.5, you are underweight. And if your body mass index is above 30, you are obese. And you can easily get your body mass index by dividing your weight in kg with your height in meters square. Underweight, your chances of getting pregnant is very low. Why? The hormones which are needed for your ovulations are in danger. And you know that without ovulation, you can't achieve pregnancy. Now, if you are obese, you are exposed to being diabetic, developing hypertension, having cardiac diseases, giving birth to a baby with a congenital abnormalities with the rest of them. Now, if you are underweight or if you are obese, you need to pay attention to your lifestyle, your diet, and also be involved in physical activity. If you're having a problem in maintaining an ideal body weight, please visit your nutritionist. The third one is drugs. If you are trying to get pregnant and you are on any medication, please visit your health caregiver, because some of these drugs that you are taking when you are not pregnant can kind of affect the development of this fetus if you should eventually be taking them when you are pregnant. For example, drugs such as Accutane used for acne, drugs such as warfarin used as an anticoagulant, they have teratogenic effects on the developing baby or the developing fetus. Now, if you are trying to be pregnant and you meet your healthcare giver, all she will do is change the line of drug that you were taking to the one that will not really affect the development of those baby. Avoid any form of over-the-counter drugs. Avoid any form of self-medications. In the other hands, you need to be taking drugs such as multivitamins and blood-building drugs in order to increase your chances of getting pregnant and also avoid any form of harm to the developing baby. An example of such drug is folic acid. Do you know that folic acid helps in blood building? Do you know that folic acid helps the brain and the spinal cord of your baby to develop very well? But the good thing is that if you want to achieve pregnancy or if you want to get pregnant, it is advisable you start taking folic acid at least 1 month before the pregnancy. Why? Because by 17th and 30th of conception, the brain of your baby and the spinal cord has already developed. So if you want to help this baby in utero, you need to start taking this folic acid before getting pregnant, so that the amount of folic acid in your body system, which you didn't necessarily get through the diet you take, will be sufficient for the normal development of your baby's brain and spinal cord, and also increase your blood level. The fourth one is adopting a healthy lifestyle. My dear, if you are planning of getting pregnant, or if you are pregnant already, you need to avoid smoking any form of cigarettes. You need to avoid taking alcohol. Do you know why? Alcohol can affect the quality of the sperm. Alcohol can cause miscarriage. Alcohol can cause premature labor. Alcohol can cause you to give birth to a baby with a low birth weight. Alcohol can also cause the death of a baby after delivery. Now, smoking on its own, do you know that cigarette has chemicals that affect the quality of the sperm and also affect ovulations? So, if you want to ensure that you give birth to a healthy baby after delivery, please stop smoking. Please stop consumption of any form of alcoholic drinks. Exercises. Do you know that exercises are good for a woman that is trying to get pregnant or a pregnant woman? Exercises such as walking, swimming, yoga, they are good in order to strengthen your body, because it is this body that will be carrying this baby for complete 9 months. So you need to start exercising your body if you are not yet pregnant, in order to prepare this body for the task ahead of it. Another lifestyle that is important is avoiding any form of violence. My dear husband, my dear fathers, please, if you want your baby to be born healthy, mature and alive, you need to ensure that the environment where this pregnant woman will be staying is conducive for her. Avoid any form of domestic violence. The sixth one we'll be talking about today is contraception. Yeah, I know that contraceptions are taken in order to plan pregnancy. Now, if you are really ready to achieve pregnancy, you need to stop taking any form of contraceptions, especially those ones that are either injected or taken orally. You need to stop taking them at least 3 months before that time you want to get pregnant. Why? Do you know that contraceptives, especially oral contraceptives, impairs the absorption of the essential nutrients and minerals that are needed for your normal body functioning and for the growth of this fetus in utero? That is why it is advisable you stop taking any form of contraceptives Remember I said especially the ones you are taking orally, the injectable ones, the implants, at least 3 months before pregnancy. To a kind of argument for this, you can use the barrier method of family planning, where we have the condoms. Remember, we have both the female condom and the male condom. Number 6 is nutrition. Now, if you are trying to get pregnant, there are some certain foods you should avoid. Foods such as biscuits, cakes that has high level of sugar, canned foods, soft drinks, you should avoid them. Now let me tell you one thing that you don't know. Do you know that soft drinks can actually affect the implantation of the fertilized ovum in your womb, that is your uterus? In that way, it will prevent you from getting pregnant when you are ready to get pregnant. Now instead of all this food, you should pay more attention to eating adequate diets, balanced diets, food rich in vegetables, fruits, sufficient water, food rich in calcium, food rich in iron, and food rich in folate. The 7th one we'll be looking at is diseases. Now, if you have any medical conditions, as I've earlier said, diabetes, epilepsy, hypertension, all those diseases that can actually jeopardize the outcome of your pregnancy, then you need to consult your physician before getting pregnant, because those diseases can endanger both your life and the life. And if you are diabetic, please never you play with your folic acid, because diabetes increases the chances of one giving birth to a child that has a congenital abnormality. But it is practicing safe sex. In order to avoid STIs, please be faithful to your partner, because some STIs such as gonorrhea, syphilis can affect this developing baby. Is being mentally ready. Now, if you are planning of getting pregnant, then you need to be mentally ready. The mentally readiness there is just talking about how you see yourself, how you feel about yourself, how you are going to deal with the changes that will be taking place in your body system by the time you are. Remember, pregnancy comes with some changes in your look, so you have to be mentally ready in order to see pregnancy as a joyful journey and not a stressful journey. I hope you enjoyed this video. If you have any form of question, please drop it in the comment sections. Remember to like the video, share, and please subscribe in order to encourage me to be bringing more of those videos. Remember, health is wealth. You can learn for yourself, and you can also learn in order to teach your friends, your neighbors, your sisters, and your well-wishers. See you in my next video. Love you.